While smoking is the leading cause of heart disease, smoking can also raise triglycerides, lower good cholesterol, damage cells that line the blood vessels, cause thickening and narrowing of blood vessels, and cause clots to form, blocking flow of blood to the heart. Dr. Samir Guru, specialist at Florida Hospital Waterman's Joint Replacement Center, explains how smoking and other lifestyle factors can affect your joints.
Smoking does have an effect on the joints as well as the bones. It does cause osteoporosis or thinning of the bones. Also, it does impede bone healing. If you were to have a fracture and you were a smoker, it decreases your healing by twice as much. Some people get avascular necrosis. A lot of them are overweight, a lot of them. I think the majority of younger patients that are getting joint replacements are because of obesity. Obesity does put a lot of stress on your joints, whether it's the hips or the knees, and we're seeing a lot of patients that are overweight needing joints at an earlier age. Also, of course, if they have an injury at a younger age, that predisposes them to developing arthritis in that joint at an earlier age. Anytime you undergo a training for athletics, it's important to follow the advice of your trainer and make sure that you warm up appropriately and stretch out before. We see a lot of injuries just because athletes or young athletes don't do those simple things, and ice after a game or after a tryout is also real important to decrease the inflammation. Exercise is good. Keep the muscles healthy around the joint to support the joint better. As with anything else, a good healthy diet will sort of help you in that respect. Certainly the way we do surgery now has changed significantly in the past few years. We perform a lot of minimally invasive surgery where we're not splitting or cutting muscle, which enables a much faster recovery. The incisions are a lot smaller on a lot of our total joints. That enables the patient to recover a lot quicker. For example, let's take a look at a knee replacement. Most patients are up the same day of their surgery and they're walking with a walker. They're usually home in about 3 days, and they're pretty mobile with a walker. We switch them to a cane in about 2 to 3 weeks, and by about 6 weeks they're doing pretty well. Usually return to sports is about 3 months, but in 6 weeks, if they're doing a sedentary job, I'd return them to work.
For more information on Florida Hospital Waterman's Joint Replacement Center, follow the Lifestyle Impact Story icon at yourhometownhealth.com.